Would you like to learn about a simple tool that can change pelvic healing, bringing relief, comfort, and empowerment to countless women? I hope so, because I hope every pelvic health therapist hears this podcast interview. It's so important. In this week's podcast episode, I talk with Pam Cole, a physical therapist and a wound care specialist, and the founder of ShePak, about what pelvic practitioners can learn from the science of wound healing. Pam brings nearly 30 years of clinical experience and shares how simple, evidence-based tools like cooling, compression, and lymphatic support can dramatically change recovery outcomes for your clients. Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started. Hello, everybody. Welcome to this episode. And today I am just delighted to introduce you to a colleague of mine. This is Pam Cole. She is a physical therapist physical therapist and wound specialist for over 29 years. She is an educator, international speaker, and she is the founder of ShePak and the president of Femicor. Welcome to the podcast, Pam. Thanks for being
Thank
here.
you so much for having me, Lynn. I'm super excited to be here.
I love this, Pam, because I don't know if you know, but I am not a big um what's the right term? Gadget person in my
Yeah,
practice, okay? So I like my hands are my magic,
yes.
and that's what I rely on the most. And so I've had a ton of people reach out to me over the years saying, "Please help me promote this, help me promote that." And I don't get involved in any of that kind of stuff. Yet, when you and I talked and I heard your story and I heard what you've developed, I was like, wow, this is something that I really want my community to know more about, because I think what you have done is incredible. So why don't you tell everybody your story and where you came from and where you're at today?
Oh, yeah, I am so glad to be here. Um, I am from Philadelphia, went to school in Boston, and then I ended up in the Midwest. And as I got my first job here in Minneapolis, I just started out really being drawn to ortho, sports med,
I
not
think a lot of
neuro,
us, a lot of
right?
us, I
Yeah,
know I did. Like,
yeah,
oh,
like
I'm going to be a sports medicine PT, and look where we're at.
yeah. Well, especially as like an athlete, I played field hockey
Yes.
and lacrosse and got injured and I got curious. And so then it led me to, yeah, so a lot of us did.
Yeah.
And in this hospital where the clinic, you could rotate through the different departments, and we had the clinic part. And the clinic part, if there were whirlpool orders or debridement orders, they come down and everyone else would be grossed out. And I'm like, ooh, 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 I want to do it. So,
Okay, Pam, that was me as well. I worked in a
okay.
nursing home, and we had a lot of, and I started a wound program in the nursing home. I loved working with wounds. So you and
Yeah,
I have that
see,
in common.
yeah,
Yes.
so and actually, quick sidebar is as we've trained new clinicians in our hospital to do wound care, we tell them like you will cross over to our side or to the dark side and love our GUIs, and like getting off a good hunk of eschar is like super satisfying, but satisfying. And then they caught the sickness. So
Yeah.
we are a special group, aren't we?
Yes. 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 Yes.
Yeah,
So
so then as these orders would come down, I would want to do them. And then I had within about a year working there, I had a vascular surgeon. He trained at Mayo, and he said, let's start a wound clinic for vascular wounds. And I said, how about for all wounds? And he said, deal. So in March of 98, we opened up the Methodist Hospital Wound Clinic. So I was the founding clinician, and it has grown now to be 6 or 7 therapists on any given day treating inpatients and outpatients. And we have over 200 visits per week, distinct visits per week, and we serve on average anywhere around 25 inpatients per day. So It has
Wow.
grown. Yeah, it's been fun.
Yeah.
And so somewhere along the way, I got invited to develop the DPT curriculum for integument. So I got to, that was super fun, was to develop that course. I taught it for 18 years at the U of M and 5 years for St. Scholastica up in Duluth. And at some point, I just handed it off to some of my coworkers who had a fresh set of eyes, and I think that was appropriate. You know, at some point, it's like, let's have someone else take a look at this. And then I've gone to Haiti and to Niger, Africa to do wound care with the
Wow.
students yeah, so it's like not just getting to do wound care with all the everything that I could ever want in in clinic, but getting to make a difference with the same basics in a different country that's under resourced and still see better wound healing. So and getting to practice my French.
Whoa, fun. Okay,
Yeah,
wait a minute. Wait a minute. You said something there. They got better results in these third world countries?
yeah, yeah.
Tell
So
me more.
most okay, yeah, the and here in the US, we just want to put fancy skin substitutes or fancy dressings and this, that, and the other on, which is great. However, so many clinics and maybe people who are trying to do their best but don't know any better are missing some of the basics. And one of them, as PTs that we really get into, is compression. Like you
Oh.
can't heal wounds in the setting of swelling. So we have to wrap them. And so we taught them, they get donated ACE wraps. They have things that are stretchy. Like we can still find ways to apply compression without the fancy dressings. Like, okay, moist wound healing. Okay, get dead tissue off. Okay, let's compress. And boom. You don't necessarily need the fancy bilayered skin substitute, you know? So,
Yeah.
yes, you can make a difference.
Interesting. That's so cool.
My other little interesting comment was I noticed that there were certain hospitals in Africa that did a better job treating their patients' wounds than some of our nursing homes here in the US.
Wow.
Doing the basics, like doing good basics. Yeah. So, and um, I feel like that is what physical therapists are really good at is taking the
Mhm.
time to be hands-on and educate. And we educate our patients, we educate spouses, partners, and we educate um, real change or empowerment for the patient. And I think that's
Yeah.
what we can do or I have done in wound care anyway.
Yeah. Yeah. That is our gifts. That,
Yeah.
yeah. Love that.
So somewhere along the way, I then had chronic yeast infections. I was the classic, like more than four per year is the definition of chronic, and
Uh-huh.
that 1 in 25 women will experience a period of chronic yeast infections. And this was a while ago. It was, I had had a round of antibiotics. It was hot. I was wearing pantyhose. There's a number of things. And so I had to start to learn, oh my gosh, my vagina isn't just doing its own thing being normal. It's off kilter. And when one night I was going bananas, like burning, intense burning itch on fire, and I didn't want to go to the ER because I know they're not going to be able to help me. I knew I needed to go get the over the counter medication in the morning, but I couldn't fall asleep. It was so bad. And I called the nurses line and they said, take a warm sitz bath. And I thought, as a PT, like, we don't add heat to inflammation or injury, we ice inflammation.
Yeah.
Bing. So I embarrassingly rigged something that I could put up there that was cold. And I actually calmed me down and I fell asleep. And even before the medication, I'm not saying I had a cure, but my vagina was much better. I could
Wow.
get to work. And I was like, oh, okay. So I invented ShePak for my own need to calm down my inflamed tissues from a vaginal yeast infection. And it did break the cycle. I got the medication and yes, that helped me get better, but and as I started asking women, like, do you run into this problem? Do you have this issue? It turns out I had women that were saying, "Oh, I could have used that when after Johnny was born."
Yes.
Like,
Yeah.
they could tell me. My experience in sharing this with women, especially when I was making test versions and doing focus groups. I had women cutting me off, telling me when they wish they had had one of these.
Wow. Yeah.
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 So postpartum for certain scenarios, I had postmenopausal women saying that they didn't have the same pain the next morning after intimacy. And it just started getting me thinking. And then so yes, I invented ShePak. I followed, getting a design patent and starting the company. And I made it to a nurse practitioner and women's health meeting. And I had a booth and this big picture of this thing behind me. No. And so I ended up with 4 rows of nurse practitioners deep, just like, what is this? Tell us all about it. I got rid of every brochure, every website card, every sample. Um, and the one unique thing was the nurse practitioner said, well, I bet this would be helpful for interstitial cystitis. So
Mm.
there are I didn't even know because I didn't know pelvic floor PT as I marched into this. But
Yeah.
then, clinicians and women started telling me what they wanted it for, and here we are. So,
Go ahead and hold it up again,
okay.
Pam.
All right.
For those of you that are listening to this on audio, please go to the YouTube channel and you'll be able to see it. Or you can click on the show notes and go to Pam's website too to see
Yeah,
it.
thanks.
But go
I'll
ahead
try
and
to
tell us
I'll
about
try
it.
to talk my way through this too.
Yeah.
So this is the box that folks will get. And yes, I've had some male patients say, "Hey, I could really use that." So I kind of did the
Oh, I love it.
slash,
Uh-huh.
ShePak slash HePak. It's really pelvic floor ice pack. So you open up the little clamshell box, and inside we have directions and tips. You get this um, gusseted pouch for just discreetly placing it in the freezer. So
Okay.
I make you crinkly noises. Here's the gusseted pouch, and then here's ShePak. So
Okay.
this is the vaginal portion. This is the labial portion or external portion, and it looks like it's only half full. But when we freeze it upside down, it does fill the
Ah,
whole volume, and then we have a little room for expansion.
got it.
So it's food grade, a little bit of food dye in with water and a touch of alcohol just so it doesn't expand too much. And you place it upside down into this gusseted pouch. And let's see, I don't have it, but it stands on its own
Okay.
and you can seal it. And that's just this nice discreet package in the freezer. So when your teenage kid goes in for the pizza bites or whatever, no one else knows what it is. Yeah.
There you go.
Yeah, there you go.
Wow.
Yeah. So
That's creative.
what I love about this is you can reuse it, like reapply ice like you would an ankle injury
Uh-huh.
or back pain.
Yeah.
So you give yourself a break and then it can be freezing and then you can go back and ice again. So it's my hope or my interest is that why isn't icing or cooling these tissues part of the paradigm for healing? Maybe
Mm.
because we didn't have something before, right? Yeah.
Yeah.
You're
Yeah.
shaking your head. Go ahead and interject there.
Yeah. No, we weren't taught that. I
Yeah.
wasn't. I mean, but it makes sense if we bring our PTOT
Mhm.
knowledge to the pelvic space and to the intravaginal space. Yes, ice is very much a part of the healing process and
Yes,
helping to decrease inflammation.
bingo. So, we don't think of that area as being injured and then necessarily needing icing. As a wound specialist, and then we can jump back into this. I started seeing patients who had vaginal wounds from surgery, from primarily cancer excisions. Um,
Ah.
a few episiotomies that weren't healing,
Mhm.
so they tried all this other stuff months and months and months. They end up in the wound clinic. And so my brain started churning. Like, I understand the phases of wound healing, what chronically puts wounds back into inflammation, the state of inflammation. And then I applied it to the vagina. And even though the vagina doesn't get quote unquote injured in some, weekend warrior thing, although maybe it could, um,
Yeah.
yeah, that, that
Yeah.
it's getting out of inflammation. It's chronic inflammation in any tissue that is a problem for the functionality of that tissue, not just the ability to heal. So when we have perimenopausal, postmenopausal women, and the vagina doesn't stretch the same
Mhm.
way, and maybe it's drier and it's getting micro traumas,
Yeah.
we have a lot of there are multiple strategies to help with that, but what about icing and looking at those micro traumas as injury and inflammation?
Wow. I just want everyone to realize that there is more recent research coming out about the actual injuries that occur in childbirth,
Mm,
like sacral fractures and symphysis pubis swelling, and like the micro tears and everything. So yes, yes, yes,
hmm
after anything that is creating trauma. I'm curious, like pudendal comes to mind. And I'm wondering what ice on a nerve issue would be like for someone.
Uh, that is the gals. So on Facebook, I get messages from women, and I've had a few just private message me like, "Oh my gosh, my clitoridenia, vulvodynia, vestibulodynia, any nerve." I'm glad you brought that up. Is we look at tissue repair for mucosal lining, nerve, muscle. They all have different healing times, but we
Yeah.
can progress those. So if we take nerve tissue and inflamed nerves, yes, ice and cold therapy does apply here. And so the testimonials I've gotten is like the one lady, she's 48, and she for 2 years was not able to be intimate with her partner because of her nerve pain. And
Wow.
she said this device gave her her sex life back and deepened her relationship with her partner. So I
Oh,
was like, I need to stay in
oh,
business,
yes.
like,
Yeah.
oh, yeah.
Okay.
So though you're onto something in that the most passionate messages I get from patients are nerve pain patients.
Wow. And so any idea, my mind goes to, well, wait a minute. Are we just numbing it up and possibly doing more harm? Or are
Hmm.
we numbing it up and creating more ability for the tissues to be mobilized, which may be helping with the pain long term? It could be
Great
both.
question. My gut feeling in what I understand about the chemicals of inflammation. So inflammation just isn't a mechanical thing, it's a chemical thing.
Uh-huh.
We right, we've heard about cytokine storms and we've talked, fish oil and vitamin D and decreased inflammation in tissues. There's chemical signals going on. And we do know the science of icing for decades in all of our modality texts has demonstrated that the chemicals of inflammation go down when we ice tissue. The way that we have been taught to ice it, I'm not saying super crazy cold, but in that 25-degree Fahrenheit range, we will get a decrease in the chemicals of inflammation and it gets us out of inflammation into proliferation. Do I have a study that specifically says nerve pain, chemical? No, I don't. But
Yeah.
when I lean on cold therapy, the decades that we have and what we know it does physiologically for tissue repair, and the trends lately in, doing ice bath submersions or, there
Yeah.
is so much to my money is on that. And my experience and my patient's experience has been that it decreases the chemicals of inflammation around the nerve. The nerve is actually repairing and besides having a non-pharmaceutical way to control one's pain, throughout the day and then getting to be intimate and then so I'm not saying this is a total cure, but my patients, sorry, I guess they're more my customers, have
Yeah.
messaged me that they are noticing a downward trend of their overall nerve pain and that this is part
Love it.
of it, just like we'd say we ice to interrupt the back
Mhm.
pain spasm cycle.
Yep. Yeah. Same thing here.
Similarly here, and I bet
Yeah.
there's muscle. pelvic floor muscle spasming that happens when, I mean, you tell me how much
Oh,
I'm here to learn.
a lot. Well, my mind goes to endometriosis
Mm,
and
tell me about that.
well, just the pain of
Mm,
those cells and what would icing? I'm not sure if anyone's really looked at that, and I'm excited to. I really want to go to the Endo Summit next year, to just
hmm
learn more about endo. That is not something that I'm an expert at in any means, and but it's such a chronic pain
mm.
syndrome that unless you get excision surgery, you're just dealing with it, and yeah, I'd just be curious if
Have
anyone's ever
you
tried this.
have you had patients, truly asking, have you had patients where they have pain, and let's just say it's from lots of different reasons in the pelvic floor, and that you can feel the pelvic floor muscles spasming or being protective or tight?
Yes.
Maybe not.
Yeah,
Okay.
no, no, no. I have, and what I find, Pam, is that it's usually a cervical restriction or a bladder
Mm,
issue internally. I have to say, I don't see a lot of IC or pudendal neuralgia or VV or any, like I am seeing a few more endo patients in my clinical
sure.
practice. But the majority of my clients are postpartum
hmm
and or pregnant. And I find that when I release the bladder and the cervix and get them happy, then their pain is gone. Their
Yeah.
muscles function so much better. Now, just this week had a client that came to see me, and she has endo, and I believe they just diagnosed her with adenomyosis. And and so she said, well, on December 15th, my doctor's going to be doing a Botox injection. And when I worked with another pelvic floor PT, we mapped out where all my trigger points were, and then she really focused in on that. And I go, great, okay, let's do that. So we did. And I mean, literally, her entire right side was crunchy and painful, spicy is what she kept calling it,
Yeah. Yeah.
and um, and some spots on the left side. And after I got done mapping it, I'm like, she just needs to do the whole right side. However, then I went and I worked with her cervix, and her cervix was restricted more on the
Mm.
left side, which was interesting. And after I got done releasing that uterosacral ligament on that side, I went back and reassessed, and her muscles were totally different.
Oh, wow.
So there's something significant about the uterine ligaments and the
Mm,
cervical mobility and its
hmm
ability to affect the muscles of the pelvic floor. Yet I would say that's a more mechanical issue that can be addressed. And we have all these other inflammatory issues that, I wouldn't say is the majority of my practice,
Yeah.
but I want to get this ShePak on my shelf and let my clients know about it and know, especially I would love to have some of my endo clients try it and see what happens.
I'd be curious. Yeah, I'd be really curious. And what I like, I this is my whole thing is it. I love that you're talking about treating the underlying cause. Like, yes, we whether for me it's seeing a venous leg ulcer and no one's put 30 to 40 millimeters compression on their leg. They're trying to do fancy skin substitutes or skin grafts, but they haven't compressed the patient. Then what are we doing here? In the pelvic floor space, it's we do have to get to the underlying dysfunction or pain. And yes, let's add in icing to
Yeah,
decrease inflammation and get so yes, as the owner and inventor of ShePak, I just think it's a part of the treatment paradigm. I
right.
am not saying it's like the only thing, but to have
No.
this tool, I my experience and what I've heard from women is it will absolutely shorten their time to healing and functionality. It is
Yeah.
making them go through phases faster to and then the emotional gain of being out of pain,
Yes.
the
Yes.
emotional gain of being connected to one's partner again. I
Yeah.
mean, it's it's And even without having any major dysfunction, even and I'd be curious to see your other, like the comments that you get from those who follow your podcast. Maybe they have something to tell us and share with us. But
Yeah.
I've seen the menopausal community. I mean, more bluntly, is women. All right, I'll tell the story as a story with it. There's a couple that I know. The gal, they just love each other. This couple loves each other so much. And as she was going through menopause, it would take like 2 weeks for her to recover from
Oh,
intimacy. I know,
oh, wow.
and so when I gave her a sample of ShePak and I said, okay, be intimate and then insert this afterwards and then you see how it goes the next morning. She told me she was ready to be intimate again in 2 days and not 2 weeks. And her
Wow.
husband said, I will happily give you an endorsement, he's like, her recovery time is shorter. This is great. I'll help you in any way. Okay, so
Yes.
it speaks to the micro trauma she was experiencing, the stretching of the vagina when it's
Yeah.
not bathed in estrogen as much. And so I am interested in all these different areas, why the pelvic floor um, gets inflamed, treat the underlying cause, but let's move that tissue through the phases of wound healing and get into proliferation and remodeling and
Yeah.
functionality. And functionality is flat, like your ability to urinate and not urinate, to be intimate, not have itching and cracking, drying, and I know that when my microbiome in my vagina has been off, it does dry out. And I was young back then and I had plenty of
Yeah.
hormones. So I can't imagine with the decline in hormones. So again, what are all the ways that ice can decrease inflammation in the pelvic floor is, I think, a wide open conversation. And I am looking forward to learning from other pelvic floor PTs. So
Awesome.
yeah.
Pam, what do you recommend with this? Is it, I
Oh
remember
yeah.
way back in the way as far as timing, is it a 15-20 minute insertion of this ice pack or less than that? Because, what's your recommendation?
Love it. Yeah, so 15 to 20 minutes. And usually with the device, you will find I'll go back and say there's no seams on the internal part. We made the seam to seal it to be on the external portion.
Love it.
And so when you pull it out of the freezer, you apply a little bit of lubricant to
Hmm.
make it, easier to insert, especially if you're someone that has a little bit of sclerosis or you are painful or too itchy. The size of ShePak, we try to go with average anthropomorphic data of length and I guess, girth of the vagina. And
Uh-huh.
we do hopefully plan on making a larger and a smaller, but we try to at least get it to be pretty narrow for the patients that are having issues.
Yeah.
And when pick a healthy lubricant, not a moisture robbing lubricant or one with the improper pH, insert for 15 to 20 minutes, but you'll pretty much know that when it goes from solid to being all liquid and you can feel that the cold is done, you can take it out. Soap and water, or this resin is a medical grade resin, so you can disinfect it with hydrogen peroxide or isopropyl alcohol, rinse that off, put it back in the bag. Give yourself an hour break, maybe, and then you can reapply.
Yeah.
So just like we would for an ankle sprain.
Yeah. And so the water, the ice is melting, and so there's really no damage. I can imagine people doing this before they go to bed and falling asleep, possibly with it inserted.
Yeah,
And that because the ice would continue to melt, there wouldn't be any damage, hopefully,
correct.
long term,
Correct.
right? Yeah.
Right.
Yeah,
Yeah,
yeah.
this is not. Oh, and the other thing with medical regard, that you're not going to get like your tongue on the flagpole, frozen
Oh,
flagpole thing.
the
Yeah,
metal piece. Yeah.
yeah, this will not do that. Yeah. So it is melting, and you will not have prolonged cold causing any frostbite.
Okay. Yeah.
That is 100%. Yeah, no
Yeah.
frostbite.
Oh my gosh.
Great
Now,
question.
Pam, there's another thing that you said earlier that I absolutely love is that wounds need compression in order to heal.
Mhm.
And one of the big tenets that I teach in my courses is compression of the tissues in order to help them to release.
Okay,
And
great.
yeah, and I remember telling you that I did have a client who had this cyst on her labia, and she had been for years had been dealing with it and it just wasn't healing. And when I first saw her, it was probably the size of a big chickpea, the
Mhm.
cyst, and then the surrounding tissue was just hard.
Ooh.
And I just gently offered compression to the tissue without creating pain for her.
Mhm.
And we were able to get that thing down to less than a pea size. And it really did help facilitate her healing by getting more blood flow into that area
Mhm.
and working with that tissue. So, I'm just thinking of perennial scars, episiotomy
Mhm.
scars, all that. We could really help facilitate the healing of those tissues after birth with the ShePak.
So two things is your manual work, because I live in a lymphedema world too. Your manual work that you did, not only, it's like the massage, but what are we doing when we do that is we are increasing lymphatic return in the
Hmm.
area when we massage. And then you're breaking up fibrosis and adhesions that have
Yes.
developed around those areas of inflammation, chronic inflammation. And we know that when we break down fibrosis and scar tissue, that we get more interstitial fluid movement, and that the lymphedema world is really expanding in our knowledge in how we move lymphatics, what supplementation include lymphatic to improve lymphatic return, and that we now say all edema is lymphedema. So,
Mm.
how do we move lymphatics that are mechanically challenged, especially in patients with a lot of scar tissue? And maybe someone like I see patients who've had cancer excisions of the vagina, the vulva, and there is scar tissue. It changes the soft tissue mechanics, but the lymphatics, and we can massage, we can do movement,
Yeah.
compression in whatever way is appropriate. The putting vertical lines in the tissues instead of horizontal lines along the lymphatic chain. And then ice does move lymphatics. So the science that comes out from doing like infrared sauna or heat sauna and then doing cold plunges and then heat and then cold plunges, we know stimulates the lymphatics and gets them moving. And so cold therapy in the pelvic floor can then stimulate lymphatic flow for very congested tissues. That's the thing to think about is this congestion that can come from just having chronic inflammation, maybe not the patient not being very mobile, not getting to exercise, not getting to move, not getting that
Yeah.
normal pelvic pistoning and figure eighting that happens
Hmm.
during walking. These are, so I think um, yes, I believe there's a strong connection between ice and lymphatic flow, and how lymphatic flow improves the wound healing and not stepping over manual therapy to get
Yeah.
into breaking up the fibrotic tissue and starting to encourage that flow out.
Wow.
Yeah,
Yeah.
great point.
So important here, Pam. I absolutely love your device, and I am excited to share this with those listening into this podcast. And I want to encourage everyone listening into this podcast. You all know a colleague that needs to hear and know about the ShePak. So please share this podcast interview with as many colleagues as you can because I truly believe this device is going to transform our results and healing for our clients, no matter what they're dealing with.
Uh-huh.
This, how long has it been since you developed this, Pam? How long has the ShePak
It's
been on?
actually been about 15 years, but a lot of that was the patent process.
Yeah, yeah,
And maybe the longest part, but now, we've been to market for many years now. And it's been, word of mouth,
Yeah.
But I would, of course, feel like it needs to reach so many more women and clients. And I just wanted to add the cost of ShePak
Yeah.
is $45
Yeah.
and it's reusable. So
Yeah.
I think that that's a value, a really great value. But for patients, they can use, there's this brochure that I have that comes with the product. Um, but focusing on its HSA and FSA reimbursed. So it's considered an ice pack, and patients can just use their HSA or FSA accounts if they don't necessarily have the upfront
Yeah.
cash. So
Okay. Wow.
yeah,
Well, that's
so
that's great to know too. Holy
try to
cow.
make it accessible for many patients. I've heard that like finger splints cost like $365 when they get billed out, but what is the
Wow.
value? And I just wanted to make
Yes,
sure that the price point was something reachable for
absolutely.
almost all women.
Yes. Okay. So thank you, everybody. Anything else you want to share, Pam, before we sign off here?
Well, yeah, so there's one thing that I'm hoping this community can help me answer. As I have had treated patients that have wounds in their vagina. So the story being OBGYN does a great job cutting out the cancer and stitching patients up. And then I've had a few where they've had chronic yeast infections and chronic bacterial infections in the area and their wounds don't heal. So then they end up in my clinic as for wound care, and thankfully we are PTs, and so we have some pelvic knowledge. And the idea being, okay, well, why isn't this healing? And what are my tenets of wound healing? And one of the things is if it's infected, it's not going to heal. Okay,
Mhm.
so in the vagina, we have this chronic BV and yeast, and the patient has been through multiple rounds of medication from OBGYN, and no one has talked to them about restoring the vaginal microbiome. And my experience with the yeast and BV and using my own ShePak is that boric acid has really good evidence for restoring the microbiome of the vagina in a very natural way with its pH. And then I apply wound healing principles. So I would have patients do boric acid for a week or two, and then insert cultures, like just a capsule of the lactobacillus that the vagina normally has. And then I would take wound dressings and wrap them around a wad of cotton like a tampon and insert it. So we'd use silver dressings against the incision. And I've had these patients just say, I cannot understand why the doctor couldn't figure this out, that they were completely like relieved in days from having chronic yeast infections and chronic BV infections. Um, and and so I'm curious about the role, just as the role of ice in wound healing and pelvic floor, is what is the role of restoring the vaginal microbiome for our patients that are dealing with nerve pain, tissue
Mm.
functionality, like it's not stretching, it's not getting wet and making its own mucosa. And we know that there is one, but I think like I'm interested in if physicians don't have time to talk about that, do pelvic floor PTs have time to talk about that? And what does this community already know about, the microbiome? And here's my circling home. I know it's
Yeah.
a long thing that I said, but the idea is we know that yeast especially likes warmth and moisture. And if
Mhm.
we insert cold into the vagina, does it at least interrupt or decrease the ability for that yeast to proliferate? Has someone done a study that inserting ice will actually take the yeast elements and break them or kill them or something? I don't know. I'd
Yeah.
be I'd be curious because I know there's one physician that starts is working on a cold device for the vagina, and she's claiming a cure for yeast infections. I haven't seen the data on that yet, but it's just a really good question. Does a
Mm.
internal ice pack interrupt or at least help with getting rid of yeast and decreasing, BV and yeast infections? So
And
I'll be looking forward to comments.
well, in my mind goes to what does ice do to the microbiome of the vaginal space with on normal people,
Ooh,
right? Like
mhm.
we should maybe start there.
Good
And
point.
then, is there a way that we can study what happens to the microbiome when we add ice? And
Hmm.
then what happens if we do have BV and, a
Yeah.
disrupted microbiome?
Hmm.
What happens
Hmm.
if we add ice? So in doing my own research, I know that the bones of the pelvis don't always return to their original position after birth. And working with my research team, they're like, wait, we need to prove that this is a thing first. And going
Yeah.
back
Good
to the
point.
beginning, so that's where my
Thank
mind
you.
goes first. But
I
um,
love
yes, like
it.
let's get this in front of some researchers.
Yes.
And I mean, what a simple research project.
Yeah. If there's any person out there looking to have a research project, I will send you ShePaks.
Okay, all right. Well, I'll talk to my research team. I'm going to be there next weekend, so if
Oh,
I
good.
can
Cool.
get, I'll talk to them and see if there's anybody in there. It's AT Stills University, Pam and um, uh, gosh, I'm forgetting my other research team. It's been a while. Pamela and Rachel, I think it is. Anyway,
Cool.
I'll reach out to them and see. But anyway, Pam, wow, it's people like you that are really changing our pelvic health
Uh,
world. And I'm so grateful to you. And this is incredible. I'm going to be ordering my ShePak today. And I hope everybody else out there will order one or at least, Pam, can we reach out to have you send brochures to us? Is that possible?
Absolutely.
Or can we
Yeah. So
download? Could we just download something from your website?
that's a great point. I do not have that up. I should do that. In fact, I'll put that on my to-do list. But yes, I am happy to mail out the brochure I have that I showed before.
Yeah,
I also have these little website cards that are discreet so that you can just hand that to a patient and she can put it in her purse.
yeah.
Um,
Okay.
Oh, but if you are pelvic floor PT, I'm happy to send a sample for you to show your patients so that they know what they're getting into.
Okay.
Some are like, huh, do I, is it too big? Especially if they're at the place where they're still dilating and trying to
Right.
get that functionality back. Are we at this size yet? I don't know.
Yeah.
So
Yeah.
when I've advertised in the APTA section before, and PTs have asked me, do you give out samples? The answer is yes. I am happy to give a sample.
Okay.
So
Great. Awesome.
we can
And
do that.
yeah, all pelvic health therapists, you guys, we all need to get the word out because I think this is going to really revolutionize supporting your clients, especially those
Well,
with pain.
and a shout out to all these pelvic floor physical therapists making a massive difference. I didn't know what I didn't know, but the amount of pain women are walking around in that you all are making a difference, whether it's postpartum or when I learned briefly, like that 75% of aging women do not need to be incontinent if they actually strengthen their muscles. You like
Yeah.
that
Yeah.
that is huge. So this community is extremely important
Yeah.
for patients with vaginas. you know?
Yes. Yeah.
Yeah.
Yes, it is. And even men's health too. I mean,
Yes.
it's such a special field, and I'm so honored to be a part of it and to know people like yourself and all the colleagues that work in this space. We are a special crew, and I'm just so
Yeah.
grateful to each and every one of you for the work that you're doing in the world. It's
Hmm.
so needed, just like Pam said. So
Yeah. Very
thank
much so.
you. And
Yeah. Thank you.
yeah, I am so honored to introduce you to my community. And please, everybody listening into this, share this information far and wide. I'd love to see this episode get the most views because I think it's just going to be so incredibly helpful. And we need to get this word out. So do your best, guys. Share it with colleagues.
Hmm.
Let them know this is out there. Have invite Pam to be on your podcast if you have one yourself, and let's help spread this word far and wide. Okay.
So, if your community wants to reach out to me, my email address is Pamela.Cole at femacorp.com.
Great. And we will have that in the show notes too, everybody. So check that
Right.
out. Pam's website will be on there as well. And I can't wait to connect you all. That's what this is all about. All
Thanks,
about.
Lynn.
All right. Thank you, Pam, for being on this. Thanks, everybody, for listening in. Here is to smoother births, faster recoveries, and cooler vaginas. All right. Take care, everybody. We'll see you on the next episode. Bye bye. Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code PODCAST50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.